Hello everyone, there is our group final presentation and the topic is the impact of the COVID-19 pandemic on people's emotional well-being. And we are the group 10, there is our group members. The first one is introduction. Let's talk about the COVID-19 pandemic and mental health. COVID-19 spread all over the world, hitting over 200 countries and regions. It's not just about getting sick. It changed how we live. Like we started wearing masks, staying home more, and meeting friends less. And it's also mixed with our feelings. A lot of people felt stressed, lonely, or and during that time. So it's not only a physical healthy problem, but also a big deal for our mental well-being. That's why we need to pay attention to both our bodies and our minds when dealing with the impacts of the pandemic. Next, let's talk about how big the pandemic was and how it hurt our minds. By the end of 2023, there were over 773 million confirmed cases and 7 million deaths worldwide. These numbers aren't just numbers. They mean many families were broken, communities were shaken, and the whole world faced a lot of loss. It also hurt our minds. In 2020, anxiety and depression rose 25%. Lockdowns left 30% to 40%, with anxiety, bottling, loneliness, and free. These stats aren't just numbers, they are real struggles of people around us. This double hit shows we must rebuild bodies and minds. Real healthy needs both, whether it's checking on a friend or seeking help ourselves. Ever smell stop counties. Let's help each other protect our well-being, because we all deserve to heal in body and spirit. Then let's talk about post-pandemic physiological problems. If we ignore those mental issues, they could become big problems like depression. So understanding them fast matters to help people. Look at topical issues. 15% worrying about anxiety, insomnia is bad. Nearly half in China had sleep trouble in 2025. Also, many fear losing jobs, like over a quarter of Asian workers. These problems are real. By understanding them, we can help. Let's work together for mental health. Since a healthy mind increases a healthy body, let's start now for hyper lives.
Okay, the second part is the spread of the anxiety and insomnia. Let's know the beginning of the epidemic. The COVID-19 pandemic broke out in Wuhan, China at the end of the 2019 and then spread rapidly across the country. Facing the highly contagious virus, and the Chinese government adopted a policy of the dynamic zero cases, including city lockdowns and then nationwide new clinic, kit testing, health code tracking, centralized isolation, and large-scale vaccination. And uh, these measures causes many problems like economic slowdown and the education moving online. And the third is an increase in mental health problems. And last one is rising the prices. Okay, then why is it that due to all these reasons, the cases of insomnia and anxiety are constantly increasing? Why has the phenomena of insomnia and anxiety become more common? And I have summarized the four key points. The first is the schoolwork. The college entrance examination is approaching. This is the most significant exam in the life of Chinese person. And the second is the blockade of the city. Taking measures such as city lockdowns to prevent the spread of the epidemic has increased the people's anxiety. And third is resource shortage. The epidemic has caused traffic disruptions between the different regions, resulting in shortage of the resource. And the last one is the high categoriness and the high mortality rates of the virus. Due to the sudden occurrence of the incident, the country and various regions did not have corresponding response measures, resulting in a large number of the deaths among children and elderly, and causing the widespread panic.
The pressure of the uh, epidemic and has triggered anxiety. First, let's look at why many people felt anxious during the pandemic. When COVID-19 started, people were worried about their health and safety. They didn't know if they or their families would get sick. This fear caused a lot of stress. At the same time, many people faced financial problems. In our country, some lost their jobs or had less income during uh, lockdowns. Students, workers, and small business owners were all under pressure. Parents also had to take care of children and work or students from home. Life became very stressful because people stayed home for long periods. They couldn't meet friends or get support. The lack of social contact made things worse. One survey showed that about percent 30 of people felt very nervous or worried in the earlier months. So anxiety was not just personal, it affected many people. Anxiety leads to sleep problems. When people feel anxious, their minds stay active and alert at night. They find it hard to relax and fall asleep. Many people said they had trouble sleeping during the pandemic. Some could not fall asleep. Others others woke up often at night or woke up too early. Students and workers had to attend online classes or meetings during the day. If if they didn't sleep well, they felt tired and found it hard to concentrate. This made them even more anxious. It became a cycle of anxiety and poor sleep. One student found that about 14% of people had sleep problems during the pandemic. Uh, if this continues for a long time, it can also cause other health problems like depression or low immunity. That is why it is important to take care of both our emotions and our sleep. Mental health support is needed. Many different people were affected during the pandemic. This includes the students works, elderly people, and even healthcare works. It is hard to deal with all the stress alone. In some places, the government and schools offered help, such as mental health hotlines or online counseling. These will helpful but not enough. Many people still didn't know where to get help. In the future, we need stronger support systems. Schools should often offer mental health education. Workplaces can give staff mental health resources. The government should also include mental health in public emergency plans. Uh, Only with long-term support can we protect people's mental health during and after crisis.
The early stage of the COVID-19 pandemic provides a vivid example of how fear of the unknown in this case. Uncertainty surrounding a new virus can significantly distort daily behavior and affect psychological states. Here is a breakdown using two major phenomena observed during that time. People feared running out of basic necessities, so they rushed to hoard food, masks, hand sanitizers, and even toilet paper. This represents a kind of catastrophizing, expecting the worst case scenario. As people saw others panic buying, they assumed danger must be imminent, triggering a herd behavior response, even if they didn't fully understand the virus themselves. Um, Elevated anxiety, helplessness, and obsessive behaviors emerge, especially with excessive hand washing or disinfection rituals, even when unnecessary. Fear of illness drove individuals to seek medical care even without symptoms or with mild, unrelated conditions. The fear of the unknown made people overly sensitive to normal bodily sensitization, mm, misinterpreting them as sign of infection. Overloading the system. This led to a surge in demand for limited healthcare services, exhausting resources that could have been better reserved for severe or confirmed cases. Trust erosion. The public's limited trust in the information available led them to seek reassurance through personal action rather than staying calm and following expert advice.
The COVID-19 pandemic has shown us how fragile mental health can be in the face of a global crisis. Beyond the danger of the virus itself, people have struggled with fear, isolation, and uncertainty. This rise in anxiety, insomnia, and frustration reflect how deeply the pandemic has affected daily life. Many were unprepared for the emotional toll of lockdowns, job loss, and constant health worries. This experience reminded us that mental health is just as important as physical health and that emotional well-being deserves more attendance, not only during emergency but at the time. Looking ahead, we must take clear steps to address the lasting effect of this crisis. Expanding access to mental health services, including affordable counseling and online support, is essential. Government should strengthen the social safety net and ensure that physical support is part of every public housing plan. School, workplace, and the community can play a role by promoting open conversation about emotion struggle and reducing stigma. By making mental health a priority, we can build a social that is better equipped to handle future challenge and protect both the body and the mind.